am Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Sometimes we have observed that when two patients sit in our fertility clinic together, they often discuss their treatment protocol. It is very good to create awareness, to share knowledge and to understand what's happening with each other. In addition to that, the most important aspect of discussing your treatment with your fellow patient is to give some morale, motivation to each other. So fertility treatment is a very difficult treatment, therefore giving motivation and counseling each other is also a very good reason to talk to your fellow patient. But often there are downsides too. Many patients compare their treatment protocol with each other and therefore are left clueless. They are confused why we are being given this kind of a medication or this kind of a dose. I wanted to give more information about that. Sometimes whether it is ovulation induction or intrauterine insemination or IVF, different kinds of brands, different kinds of dosages or protocols are given to different patients. Now you may be of the same age. Let's take, say for example, two patients are of 30 years old and they present and we give different protocols to both of them. What could the reasons be? Well, the most important thing to understand is to see what is their antral follicular count. As in, when we do a scan, we try to understand how many follicles are there in their ovaries, and to confirm this fact, we also do hormone tests. When we see the hormone test and we see that the follicle stimulating hormone, AMH, anti-Mullerian hormone, luteinizing hormone, estrogen, progesterone are normal or abnormal, based on that treatment protocols are altered. If the antral follicle count is normal, then a normal dosage is given. But if it is low, very high dosage of hormones may be given for your egg to grow, to ovulate, for a better chance of having more number of eggs. It could be ovulation induction, IUI or IVF as well. When the follicle stimulating hormone is normal and the AMH is normal, then normal doses are given. If the FSH is high, the AMH is low, very high doses of hormones may be given. But if the FSH is normal, the AMH is high, and we see on AFC that there are many follicles present, then giving a high dose may not be good for the patient, because many follicles might grow and the patient might get into something called as ovarian hyperstimulation. In any kind of treatment protocol, especially IUI and ovulation induction, not more than 1 or 2 eggs are expected to grow. In IVF, growth of more than 20 eggs and retrieval of these eggs may lead to something called as ovarian hyperstimulation. So a lot is based on the body type, the number of follicles that we see on scan, the hormonal levels. Every patient is different and the response of each patient to medication is different. Therefore, to gain knowledge is good, but comparison and interference in treatment is probably not a good idea. You should discuss with your doctor why treatment protocols are different, why you are given such a high dose. Now, high dose does not mean you will get a large number of eggs. The eggs may also be of poor quality. So these are fine balance. It's a tightrope walk that a fertility specialist needs to walk on to decide what kind of treatment protocol to give you. If you want to understand more, if you've had previous treatment protocol failures, it could be any kind of treatment you've had failures and you're not able to achieve pregnancy, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.